Welcome back, dear viewers, and our first guest of the evening is Dr. Vivek Singhal, MD in dermatology and consultant dermatologist. Dr. Vivek, good evening. It's really a pleasure to have you with us on Hala Kuwait.
Good evening to you and good evening to all the viewers, and thank you for inviting me to the show.
It's really a pleasure, doctor. And usually we ask dermatologists about what do you do with the patients or people who come to your clinic and how we take care of our skins. But we will ask you first a different question, which is, doctor, let us know more about your personal skincare routine. We'd like to know more about the dermatologist, how Dr. Vivek usually take care of his own skin.
Yes, that's an interesting question, because as males we know that male do not like to use too many skincare products. And being a minimalistic person, I like to keep it to the basics, and even for my patients I try to prescribe the basic skincare routine.
As simple as possible.
For me personally, for example, I will just use like a cleanser in the morning, a toner, and then a moisturizer and a sunscreen. While at night time, I will be using the cleanser again once more, and a moisturizer or plus a hyaluronic acid based serum. I prefer to do like a soft scrub once a week for sure. And as dermatologists we have access to all the machines, so it's very easy for us to treat anything rather than prevention. So but with age and with progression, what I have realized is prevention is better. So I prefer to do one session, for example radiofrequency microneedling once a month or once in 2 months. It helps to keep the collagen in a very good shape.
Exactly. And especially, doctor, people before used to believe or think that skincare and moisturizers and going to dermatologists only exclusively for females. But nowadays, especially like with the rapid growth of information and taking pictures daily, and you can watch yourself daily on your phone, you can share content including your face, and you use your face to share with the social media, or especially for people who appear on TV, let's say, or in the social media.
Sure.
So the awareness is getting higher, especially for males, because skincare is healthy. You can prevent, when you take good care of your skin, you can prevent a lot of damages that can happen, especially like acne and rashes. And doctor, speaking about rashes, how do you help your patients to manage rashes and other common skin issues, especially during some specific time in the year, or like a season in the year that might affect their face or their skin?
So it's an interesting question once more, and thank you for this question, because as a common person thinks, dermatologist deals in rashes. Now rashes is the commonest term which is used for all the skin ailments.
Exactly.
But you will be surprised to know, as dermatologists we have more than 3,000 skin diseases which we treat, and they are all, majority of them will be classified under the term rashes. So one term for so many diseases. Now it's very important to diagnose the condition very well. Now the diagnosis is usually one out of those 3,000 skin conditions, and the treatment varies according to that. For example, if a rash we see and we evaluate it, with experience and training we can find out if it is an infective cause or if it is an allergic cause. So for example, if it is like a fungal infection, the treatment is totally different and directed towards that. While if it is an allergic cause, we need to evaluate it further, whether it is due to extrinsic causes, external causes. For example, we used a new perfume, we used a new cream, a lip balm which is triggering the allergic rash, or even a nail polish. It will be surprising. Sometimes we put the nail polish on the hand and we get the rashes in the neck. So it's quite a vast variety of symptoms that we see when it comes to rashes. Now
it comes with food also.
It can come with the food. The food is one of the least common causes of skin allergies. It's very surprising for viewers as well, I think, because food is implicated in so many things, and people think, okay, I ate the fish, so I got the allergy. Now, food is one of the less common items which causes skin allergies. Except the peanuts, the fish, it can trigger some type of allergies, but most of the food items are usually free, or they don't cause so much of skin allergies as compared to the airborne pollens or the flowers, or the if we are going to a green area, we get a lot of pollens which can actually trigger more allergies. Then there are allergies which are due to endogenous reasons, like they are coming from inside, in which we do not have a reason why it has happened. For example, there can be conditions like psoriasis, lichen planus, those type of things, and the number of conditions in dermatology is vast and enormous.
Exactly. Doctor, there's a lot of people, or a lot of cases, they sometimes they notice a change in their skin, and sometimes they get, let's say, a sore in their mouth, and it stays only for one day, sometimes it lasts for months. And also on the skin, sometimes you have changes that can be permanent, sometimes it's temporary. So how do you know if a mole is serious, doctor? Is there any age that believe patients should consider having moles evaluated? Like, for example, if you have, let's say, teenagers or people in their 20s or 30s or 40s and 50 plus, is there any difference between them when they get something new at their skin, especially if it looks like a mole?
Okay, so viewers, this is again a very interesting question, because moles, the rule is as simple as A, B, C, D, E. We call it the A, B, C, D, E rule. Now, what does this A, B, C, D, E stand for? A stands for asymmetry of the mole, B stands for the border of the mole, C stands for the color of the mole, D stands for diameter, and E stands for evolving mole. Now, if we see changes in any of these A, B, C, D, E, we tend to think of changes in a mole. Usually moles are present either at birth or due to the sun damage. But if we see any of these A, B, C, D, E changes, then we evaluate it further by using special techniques called dermoscopy, or we go for skin biopsy after clinical examination. So if we see any of these changes, it's very important that you should get it evaluated with a dermatologist who is an expert person and trained to look for any changes which are going in a bad way. So there is no particular age per se, and usually we look for old moles which are changing according to these guidelines.
Exactly. And you know, doctor, also speaking about skin issues or skin problems, and one of the most common issues, it can be psychological sometimes, or let's say social. You can be social shy, or it can lower your self-esteem, especially like when the patient shares with you that their skin condition is causing them that. Like, for example, social isolation, they feel shy from the society because of skin problems, or they can have low self-esteem because of what they're facing with their skins, and they don't have any solution. They feel like they're lost.
This is again a very interesting question, because we see a lot of teenagers. In fact, acne is so common, and they are still in their growing age, and sometimes they become shy or aloof because of these pimples or acne eruptions, or sometimes due to hair loss. So it's very important to do the counseling not only for the person, but we usually try to include the family members, their friends, their social surrounding. And there are now a lot of patient help groups which are available, both offline and online, which are available, in which we help the patient to know that he is not alone, and this is not something which he should be shy of. So we try to give them the confidence, and at the same time we treat the condition. So it's a sort of a counseling session which happens, plus we start the medical treatment in the best possible way, so that we can take the person out of this low esteem phase and bring him back into the society as a useful and important person, so that he can be socially and economically productive in the coming years.
Exactly. And doctor, also let's talk more about let's go a little bit to the past. Before, like especially women, they always have awareness and seek the best for their skin and for their look. And before, they used to follow trends and fashion and read about skincare through magazines. Sometimes it can be from reliable resources, sometimes it's not, but they're aware now more because there's also the internet and there's videos, and they can go and see a whole procedure or anything that's related to skincare or cosmetics. So they know best now, and sometimes they can compete with the experts about like skincare or what's is best for their skin according to their readings online, also to the reviews others they share with them. But of course, doctor, same as you as a dermatologist and consultant, you also relay and read, you go to conferences, you follow scientific journals and articles, so you get updated more than people like in public. So you know more, doctor, and also patients come and seek your help, especially women, and they always ask you, of course, this question about fillers and other injectable cosmetic treatments. So what do you think about it, especially now, and what is the latest when it comes to fillers and other injectable cosmetic treatments?
So this is the new trend, or I will say it's a upgrowing trend in the last 10 to 20 years.
It has to be up to date.
Yes.
Yeah.
So what is happening is we used to have a lot of plastic surgery and surgical procedures which were available, which are still available, but they had a downtime. So there was a recovery time, and sometimes the patient is not satisfied with the results. Now these injectables are trying to compete with those type of procedures.
Exactly.
Of course, they cannot reach the gold standards of plastic surgery facelifts, but at the same time, injectables per se, like Botox, fillers, like mesotherapies, they have advanced and they are being used on a very large scale. Their use has increased in the last decade by at least like 40 to 50 times, which is
That's
a tremendous
huge
growth in the
Exactly.
industry. And the main reason is definitely the social awareness, the easy availability of these products, trained physicians who are giving professional treatments in this aspect, and the results are quite getting predictable. The products are getting refined, and the results are quite predictable. So
Exactly.
that makes it very interesting as a modality, and with minimal downtime. So the best part is you go for a procedure, you finish the procedure and come back to your work. So it can be also called like a lunchtime procedure, and it does not disrupt the individual's lifestyle.
Exactly. So, doctor, from injectable treatments, cosmetic treatments, and also from fillers and the rapid growth, let's say in the dermatology and science regarding it and how flexible it can be now. So, from the future and the present, let's go to the classics and the past. Usually, one of the first or frequently asked questions from patients seeking your help, doctor, seeking your consultation, is about acne. There are two types. Mostly it happens in your face, which is the classic acne, and also the severe or stubborn acne. So what are the differences between them and between their treatment also?
So usually in acne, we classify them into 4 categories, 1, 2, 3, 4, and then there are special categories of acne. And accordingly, we follow like a step ladder approach. We call them the step ladder approach. So we have like a basic treatment, if the second level of treatment, the third level of treatment, depending, using oral medicines, and plus the lasers and the latest treatments in the field like cold plasma technology. So these are treatments which are individualized for the person. So as a dermatologist, we evaluate the patient. What is the severity that he is suffering from? What type of treatments he has taken or she has taken, and whether it has been a resistance to those treatments.
Exactly.
And then subsequently we design our treatment protocol for the particular individual. So for example, if a person with very severe acne is coming, and you don't expect that only the creams will work or only the face wash will work. In that case, we have to go for more advanced forms of treatments like retinoid therapies, like oral treatments. Plus there are certain lasers or light based therapies which are there now. The blue light is an interesting concept in this, and now we have the cold plasma technology. So we have a plethora of treatments which are available. Only thing is, one must start the treatment early. In acne, it's very important to start the treatment early, especially with severe acne. The reason is because these type of acne cause scarring, and this scarring, once it happens, it takes a lot of time to get the improvement subsequently. So it's better to avoid the scarring rather than treating it at a later stage.
Exactly. And speaking, doctor, about skincare and some damages that might happen to our skins, such as some, let's say, in cases, human can face burns, then they can face like type of cancer, skin cancers. They can face, let's say, sometimes like and other cases they face like long time treatment for a skin issue they're facing. So usually you have cases similar to it, and sometimes it can be bad news, or like it's bad news, or it's something hard to handle from the patient side. Sometimes it's something hard for the consultant to start to share the news with them. So how do you advise other consultants and doctors and dermatologists? How do you deal with this situation, and what type of advice you give your colleagues when it comes to situations like that? It can happen.
It is. We do face these situations, and I feel the most important aspect to handle these situations is empathetic handling. And we need to, I usually use a term called hand holding of the patient. So we try to organize a one-to-one meeting and with family members if possible, so that we can advise on not only the diagnosis. For example, if a patient, we have done the biopsy and it comes out positive for, say, cancer, and we have to give this news for the patient. So in that case, we will definitely go for a hand holding, empathetic, detailed explanation of the condition, and plus at the same time I will also like to give current treatment modalities which are available for the person, and what is the best possible options to in the future for this particular person. So in a nutshell, what I will like to do is like a very sympathetic and empathetic approach.
Exactly.
While delivering these results.
Well, thank you so much, doctor, for being this evening with us on Hala Kuwait, and such a valuable information you shared with us regarding
Thank you so much.
dermatology and a lot of subjects regarding it. So thank you so much, doctor, and wish you all the best.
Thank you.
Thank you. The viewers, we just had with us Dr. Vivek Singhal, MD at dermatology and also consultant dermatologist. Let's go now to check our second report of the evening. It's about the French musical evening. Let's have a look at it. We'll be right back. Stay tuned.